You know, June, as we were saying, is Men's Health Month. And of course, your heart is one of the most vital parts of your body to keep healthy, right? So today we have Dr. David Fieno of Shelby Baptist Medical Center joining us virtually to discuss heart health in men. How you doing, David?
I'm great, Sheldon. Thanks for having me.
All right, so what do we need to know about Heart Health Awareness Month?
An awful lot. 2 out of 3 people in the United States are going to die of cardiovascular disease. Some of those things that cause cardiovascular disease, high blood pressure, diabetes, certainly things like high cholesterol, we have treatments for. Just to be as proactive as possible, try to have a good relationship with a primary doctor and or a cardiovascular specialist.
Yeah, without a doubt. And I guess when we talk about heart health, maybe one of the more topics that we hear are talking about heart attacks. And men, are they more thought to have happened to men than they do women?
Great question. Unfortunately, men are more likely than women to have a heart attack, and a more severe heart attack at an earlier age. Average age of men to have heart attacks is age 65. Average age of women is age 72. And unfortunately, the heart attacks in men tend to be more severe as well. So it's hard to imagine a approach to prevention for men that's too proactive. So they need to do everything they can to keep their heart and cardiovascular system in good shape.
I'm going to kind of go off script real quickly because I wanted to ask when, and it changes, I'm sure, and it can be, but are heart attacks, when you're experiencing it, is it painful? What's that feeling like?
It's different for different people. Unfortunately, 20% of heart attacks are completely clinically silent, so there's no symptoms at all. This is where the doctor says, I hate to tell you, sir, but you've had a big heart attack. Symptoms can range from chest pain, chest pressure, throat pain. And about 10 years ago, we realized shortness of breath is just as serious as chest pain. So something to keep in mind, an unusual awareness of your breathing, something we call dyspnea in cardiology. And then other things to keep aware of: unexplained indigestion, neck pressure, radiation down one arm or the other. And what I tell people is when something changes, go get checked out.
Yeah. And you alluded to this earlier. What are some of the things that we can do to prevent the possibility of us suffering through some sort of heart health issue?
An awful lot of things. It starts with a basic visit and awareness of your system. How's your blood pressure? How's your cholesterol? Are you a diabetic? Do you smoke? Do you eat right? Do you exercise regularly? All those things are basic. Then we have at least 3 or 4 different classes of medications that can help with each and every one of those things that I just mentioned. And as an internist and cardiologist, I go through those systems one at a time. I see which ones we can make the most progress with, and ideally within 6 to 12 months' time, get everybody to where they need to be. It also depends on you and I, Sheldon, getting serious about our health and listening to our doctor's advice, making that 30 to 45 minutes a day to exercise, trying to eat right, lots of fresh fruits, fresh vegetables, and avoiding processed things.
Well said right there. Dr. David Fieno, we certainly do appreciate it, and I'm glad that your heart is doing well. We'll see you later, my friend, and we'll